For those not killed by bullets, death often comes from disease, outbreaks, or the absence of critical healthcare. I'm Kenneth Lavelle, the Director of Operations for MSF. I will explain to you how we've had to adapt to the funding cuts that are having a devastating impact for the people in Sudan. When the war erupted in April 2023, it escalated into what has become an almost complete ethnic cleansing of part of the population in West Darfur. It's unfortunately a repeat of trends that we have seen for more than 2 decades. With the near total collapse of public health services and limited access to secondary care, MSF prioritised the continuity of life-saving support in El-Genina, the capital of West Darfur. Our focus has been on paediatric care, nutrition and emergency services for the most vulnerable populations. We identified another urgent gap: maternal care. Maternal mortality rates had been alarmingly high, averaging more than 1 death every month in 2025, and there was almost no access to safe delivery services. Many women are forced to give birth at home with traditional birth attendants who are often untrained or they lack the proper equipment, putting both the mothers and newborns at serious risk. The precarity of this situation deteriorated further after the budget cuts were announced by the US government and others. Key humanitarian actors lost their funding. Maternal activities risked stopping overnight. We needed to find a way to fill the gap, so we established a partnership with the Sudanese Family Planning Association, a national NGO supporting the Ministry of Health Services in El-Genina. MSF provides financial support to the SFPA. They can continue offering free maternal care for non-complicated deliveries in the El-Genina hospital, leaving MSF to focus on the complicated deliveries in the same hospital. Since June, together with our local partner, we've assisted more than 1,300 deliveries, meaning over 1,000 mothers and their newborns have received the safe care. We are now funding a local NGO to fill this critical health gap, but it's not a question of the cost. It is about the lives at risk every day. By August, Sudan's health response had received only 24% of the required funding. We repeat our call to donor states and those with political influence to act now. It's time to step up. Put your pledges into action. For those not killed by bullets, death often comes from disease, from outbreaks, or from the absence of critical health care.